Good morning. It's 9 minutes after 9 o'clock on a beautiful Monday morning, and we've got Congressman Denny Rehberg sitting at the table with me. Denny, good morning.
Good morning, David.
Denny, there are so many things that we want to talk to you about, and I want to invite our listeners to give you a call if they have a question or a comment for you, and I'm going to give them that number again, 1-866-627-5483. But before we start, there's been a lot of comment about something that I addressed just a little while ago. I think I know you well. You're 33rd degree Mason. You're a member of the Shrine. And I mention that because both of those organizations spend a lot of time and a lot of money. In fact, the Shrine spends over $1 million a day in their children's hospitals. So I know that you, and your dad, by the way, who's also a 33rd degree Mason, have a lot of empathy for youngsters who need medical attention.
You bet.
Then S-CHIPS comes along, and Denny Rehberg, Congressman Rehberg from Montana, voted against it. Let's talk about that.
Well, I might also point out that I spent 3 years as the chairman of the Montana Muscular Dystrophy Association.
Well, that's true.
What Jerry does on Labor Day, I was intimately involved in, and eventually became a national vice chairman of muscular dystrophy. So kids have kind of been my special interest in kids charity as well, and health care. S-CHIP is, as you know, a insurance program that was set up for poor children to try and give them the opportunity to have health insurance when their parents or whoever was taking care of them, their guardian, could not pay for it, so we could get to the appropriate and proper health care coverage for the poorest of our children. And it was set up during a Republican-controlled Congress. So S-CHIP is and was crafted and sponsored by the Republican members of the House and Senate in Washington, D.C. Now that the Democrats have control in Congress, they have decided, and we have the proof, from 1994 on, that when Hillary Clinton was unsuccessful in getting a government-run health care system, universal health care paid for by the government, essentially destroying the system that we've got in place today, that they made the determination that since they weren't going to win that issue, they would begin trying to do it incrementally. And at that time, they suggested that they would start doing it with the children's programs. And so this Congress, in the House of Representatives, not in the Senate, now Senator Baucus has an entirely different package, and he says the House bill that passed, that I voted against, is not acceptable to him as well. They've carried it too far. And what they've done, and I think the people of Montana would agree with me, they're covering illegal aliens, the children, and I don't think we ought to be doing that. In their initial proposal, and we amended it, they included children up to age 25. We were able to amend that back down to 21. They have allowed states the opportunity to get waivers so they could cover children in families that have combined income of up to $100,000. And so just exactly what they suggested they were going to do, they are doing. They have taken it to the extreme, and they're attempting to make this the first step at a government-run healthcare system in this country. And, I got to tell you, David, one of the most difficult, and I think I probably said it the last time I was on your program, that the two most difficult issues we have confronting us in the world today, in the nation of America, is immigration, how are we going to solve the issue, and health care. That if we don't find a way to make health care affordable to more people, because there's this ever-growing gap between those that can afford to pay and those that cannot, if we don't solve the issue, people will throw up their hands and say, see, we told you the free market system doesn't work, we need a government-run system. And I don't want to go to that direction. I think we have the best health care system in the world because we have the free market involved, and we have competition, and with competition you get choice. And I think in America we still want to pick our doctor, we still want to pick our hospital, we still want to work with the nurses that we want to work with, and we still want to have the choice when it comes to medical care.
We had an excellent example not too long ago, Denny,